Every day, my staff and I talk with constituents in my district who find themselves facing difficult health and human services dilemmas and challenges. The good news is that there are many resources available to help these individuals, from government programs to private, nonprofit, and ministry organizations in their communities. There are so many resources, in fact, that it can be very easily become overwhelming for a person to know where to begin to seek help. This is where the 211 service comes in. It's a gateway to all kinds of help and the right kind of help. Individuals can get a holistic answer to their issue rather than an incomplete response that may only lead them to additional challenges. In 2017, the increase of 211 contacts by over 30,000 people is an example of how many Pennsylvanians truly need help in finding resources for their everyday lives. The work United Ways are doing to bring more awareness to 211 in our communities is a vital part of the success being experienced by those seeking services. It's my hope that with the availability of resources provided by 211, fewer Pennsylvanians will find themselves in hard times because of the inability to get the timely help that they need. With the availability of 211, I support future partnerships between this service and the Commonwealth. I'm supportive of this idea because I believe we can prevent many more of these crises that I described from happening to our neighbors and our friends, and because there's also an opportunity here to increase efficiency and cost savings in the delivery of health and human services. For an example of a partnership, PA 211 is currently contracted to train resource specialists to assist with pandemic response in partnership with the CDC and other 211s across the country through the Flu on Call project. Flu on Call is a plan which would be activated in the case of a pandemic. While this season's flu is deemed widespread in most of the U.S. states and territories, it's not currently a pandemic. In a pandemic, large numbers of people are ill and seek care. There's a surge on medical facilities and potentially a delay in seeking care that can also impact access to antivirals. In the event of a pandemic, 211s in 12 states would staff triage lines along with trained medical professionals to provide public information and clinical advice about pandemic flu. I look forward to continuing to work with United Way, my House colleagues, Senator Brown, and others to help provide more efficient, comprehensive help for Pennsylvania's health and human services need through a public-private partnership for 211. Thank you.